Medical Monday with Nacrae. I really need to come up with a jingle. Like, at this point, somebody make me a jingle, seriously. But anyway, today we're going to be talking about how to pick the best medical insurance. Whether you're starting a new job, or you just you're in a certain insurance and you don't know what insurance you want to pick next, let's talk about certain things to consider prior to you choosing a medical insurance. So there's a couple of different insurance policies that are out there. And the ones that are like, I'll tell you which ones are like best or which ones are not as great. So definitely the world renowned or like the most renowned are Blue Cross Blue Shield, United Healthcare, Cigna, Aetna. Those are the ones that I can think of right now. And then there's also, you have state insurance, so like Medicare and Medicaid. So in these different insurance companies, there are different policies. There's HMO, there's PPO, there's EPO, there's the state plans within those insurance companies for some of them. And so when you're picking insurance, it's very important to know what you want out of that insurance. So at HMO, what that basically is you are restricted to specific hospitals or specific sites. So that means that your doctors have to stay within a specific group. So for example, if you've chosen an Edwards doctor, if that Edwards doctor or that Rush Copley doctor or that DuPage Medical Group doctor is in your group, you have to stay, is your primary care physician, you have to stay within that group for any other specialty that you see. So if you want to go see a dermatologist, they have to be in DuPage Medical Group. If you want to go see an ophthalmologist, they have to be in DuPage Medical Group. If you want to go see an endocrinologist, they have to be in DuPage Medical Group. So for an HMO, that's what that basically means. You are restricted to specific places based on who you choose as your primary care physician. PPO, you pretty much have just access to everywhere. You can go really anywhere. Most places accept PPO policies. So that is kind of like the gold standard, I guess you can say, of policies. Now, sometimes when you get an HMO policy, you don't have to pay as much out of pocket, depending on the policy that you have. So for the best insurance, really honestly, is union insurance, simply because you typically have like lower costs for everything. I've always been on union insurance, so like your copays are like $30, $20, and then like your emergency visits are $100, and the deductible is like $50. I mean like $500 that you have to meet as like maximum out-of-pocket expense. So let's talk about what deductibles mean. Let's talk about what coinsurance means. Let's talk about what your out-of-pocket means. So when you go into a doctor's office, you will always have to pay something unless you have a $0 copay, a $0 deductible, just $0, or unless you have state insurance. Most places, if you have Medicaid, they will not accept Medicaid simply because they might not be contracted with that type of insurance. Medicare is targeted towards the older elderly population, but Medicaid is just if you're on state insurance. So if you have private insurance and you have a copay means that you just have to pay that every time you come in. So if you have a copay for a regular office visit, that could be $20. If you have a specialist copay, it can increase. So before going into any doctor's visit, it's important for you to call your insurance to know what your out-of-pocket is going to be. That way, when you get there, you're not like, I didn't know I had to pay $50. Just cut all the middleman out, call them so you know, like, and you can check and verify. Be like, I got off the phone with my insurance company, and they told me I only had to pay $45 today. So that's what I'm paying. And if you have a problem with that, you call my insurance company. But it's important before you have any procedure, any office visit, anything like that, to check with your insurance company of what your coverage is. So that's what a copay is. Now, a deductible means that sometimes, like, if you have a procedure or sometimes office visits apply to a deductible, which is why it's important for you to call your insurance company. That means you have to sometimes meet or pay towards that deductible in order to be seen. So it's kind of how a car insurance deductible works. For them to cover certain things, you have to pay towards the deductible. So sometimes your office visit could be hundreds of dollars because your deductible is thousands of dollars. But then where it comes into play is you have a maximum out of pocket. So for example, your deductible could be $500 and your maximum out of pocket could also be $500. So once you meet your deductible and you have, say you have a $500 deductible, a $0 copay, and a $0% coinsurance, then after you meet that $500 deductible, you don't have to pay anything for the rest of your visits for that in that insurance calendar period. So coinsurance, I hope I'm making this make sense. It's kind of like very intricate stuff, but I'm trying to like break it down as much as possible. So coinsurance is usually a percentage. So coinsurance is like you have a 30% coinsurance, a 20% coinsurance, a 10% coinsurance. So what the coinsurance means, if you have a 10%, your insurance will cover 90% of your visit, leaving you with 10% to pay. So sometimes if you have a coinsurance and a copay, not only do you have to pay that copay of $30, but you also have to pay a 10% coinsurance. So for example, if your office visit, the total office visit bill is $100 and you have a 10% coinsurance and a $30 copay, that means you have to pay $40 because your coinsurance is 10% and they're paying 90% of it. So that leaves you with a $10 from the coinsurance and then $30 from your copay. So now you have to pay $40 for that. That's just like a low balling number of what an office visit could be. So when you're looking at insurance, you want to make sure that you have a very low, if not no coinsurance, so that they're paying majority of that service or that visit. You also make sure they have a low deductible, because sometimes like you could have a $5,000 deductible and you're paying like $400 a month for that private insurance, and you might never even use the insurance. So it's best sometimes to just really like gauge what policy will be best for you based on your needs. So if you know you're going to the doctor a lot, then it's best for you to find whatever policy fits for you, but just being cautious of what money you're spending in and what they're covering. So you don't want to be paying like $500 for a policy and then also paying $500 every time you go in for a visit. So that logically just doesn't make sense. So making sure that just know the ins and outs of your policy prior to choosing the policy. Don't just pick one because you're like, oh, right now these numbers look low. No, know what the numbers mean. So look at coinsurance, copay, deductible, and out-of-pocket expense, and also what's in network. For HMO usually, so what HMO stands for too is health maintenance organization. And so usually, like I said, there's a lower out-of-pocket expense, and you just have less freedom to choose the doctors and the places that you go. And typically for HMO policies, you have to have referrals for different specialties, for different procedures. And it's just a lot of like moving around, calling, a bunch of stuff. For PPO, you don't need a referral. Like I said, you can kind of go wherever you want to go. You have more provider options, and sometimes if you have a PPO, there's higher out-of-pocket costs. So if you just kind of want to go wherever is beneficial for you, or you have a specific doctor that you already like and you want to make sure they're in network, a PPO might be the best option. Especially PPO is good too if you work a union job. Usually those PPO policies, you don't have to pay a whole lot of out-of-pocket expense. EPO, I forgot to say what PPO means. PPO means Preferred Provider Organization. So that kind of just tells you right there in the name that that's kind of like the go-to, insurance, like the holy grail of insurance, basically. But typically that's associated with a higher cost. EPO is Exclusive Provider Organization. Ooh, you're exclusive. So this one, typically you have to pay a lot more for emergency purposes for EPOs. You don't need a referral. There are lower out-of-pocket expenses for this one, but less freedom, similar to like the HMO for your providers. Not every hospital or doctor is contracted with EPO policy. So you once again just have to check to make sure. And also when you're going to different doctors' offices, that is your responsibility to check to make sure they're in network, not their responsibility. So prior to you going there, you should be calling your insurance company, like I said, to make sure that you will be in network for what you plan to get. So that way you're not stumped with a bill months later and you're like wondering how you're going to pay for it. And then there's also POS, which is point of service plan. And this one, you do have to have a referral for a lot of procedures and appointments. And referrals are required, and your doctor kind of coordinates things for you within that. And so I would just say when you're presented with different options I try to break it down as much as I can in like my mind of what these different policies mean and what they are. But I would say definitely when you're looking, just compare all of the policies, whether that's a PPO, a HMO, EPO, POS, just so you know your options for all of them. And then also compare the out-of-pocket expenses. So if you frequently need care, if you need to see specialists all the time, if you're having a baby, you're definitely going to want lower out-of-pocket costs because you have to go in frequently for those appointments. If you have a planned surgery coming up, like those are, especially if you have like a surgery that's going to cost a lot, that's like the best year for you to get everything done. Like all of your visits that you know are going to cost money, go then, because surgeries usually eat up your deductible. And that way your other visits, you don't really have to pay anything out of pocket. It's covered by your insurance. So just always be checking, you know, like what you're doing in that year. And also some insurance companies have like FSA accounts or FSA dollars where you can use money. You load a card and it's for, and sometimes your employer can pay into this as well. And you can use it towards medical expenses as well. Another thing too is to compare the benefits. So whether your pharmacy and drugs are included if you need prescriptions, if you're pregnant, what maternity services are covered? Do you get ultrasounds at every visit? Do you get only one ultrasound for your full pregnancy? Those are things to consider as well. And then also there is like, if you don't have insurance or you don't want private insurance, because sometimes when you like look at the grand scheme of things, if you're a pretty healthy person and you only go once a year, and you just don't want to buy into private insurance, there is a medical credit card called Care Credit that you can use. And that basically they give you whatever limit based on your credit score, and you can use that towards medical expenses. You can use that really towards anything in a doctor's office. Like if you wanted plastic surgery, if you wanted whatever, you can use that towards medical procedures and office visits and things like that. But it always is good to have insurance, medical insurance, as just in case, because you don't want to end up in a hospital for an unplanned emergency. Obviously, emergencies are never planned. And then now you have a bill of $10,000 when you could have just paid $500 when you have insurance. So it's just like an extra little cover just to make sure you're all squared away. I hope this video made sense. If not, I did waste about 15 minutes just blabbering, but leave questions if you have them in below. I'll try to like type it out too if it makes more sense that way. I know I can kind of talk quickly, and I think I can think that like it might make sense in my head, but it might not be translating that way, but we'll see what happens. But yeah, I thank you so much for watching this video. Thank you for tuning in to another Medical Monday with Nacray. I'll see you next time.